about to sell you something that might surprise you. A lot of patients come in and they tell me, someone told me I need spine surgery. Well, let me tell you, a lot of times they don't. And in fact, most patients don't need an operation. Every week I meet these patients who are really terrified, and I am able to give them some amount of reassurance. And a lot of times their problem might be solved, or maybe not solved, but helped without actually making any incisions. Sometimes surgery is the best option, but knowing that difference between option versus need is very, very important in figuring out the best treatment strategy. So why are so many people told that they need spine surgery? And a lot of times these are not spine surgeons that are saying that. It might be a different kind of doctor, or it might be their family member. Well, the reality is when we take an MRI of someone's spine, many of those patients, especially as we get older, will show degenerative changes. So with degenerative changes comes things like facet arthritis, comes things like disc degeneration. These are all parts of aging of the spine, even nerve compression. And if I took an MRI of 100 people who were over the age of 60, a lot of them would have these degenerative changes on their imaging, and even younger as well. And so a lot of patients might think, or might be told, just fix it. The reality is we can't just fix anything. We can't really grow a new spine, at least in today's age. And that's when I think that the misunderstanding about the need for spine surgery happens. So when is spine surgery a good option? And I really emphasize the word option, because options is really what spine care is about. It's about thinking of what all the different options are. Well, we consider surgery when a few different conditions have met, but primarily when the patient's symptoms are so severe that they do not want to undergo the continued decrease in quality of life and pain, and they are willing to undergo the risks of spine surgery, of which there can be many. I always say there is no such thing as a small spine surgery. The other thing that's really important when considering a spine surgery is back pain is universal. 80% of Americans will experience back pain in their life, but not all of that back pain can be improved with surgery. As much as I am a surgeon and I would love to say I can cure everyone's back pain with a knife, the reality is that isn't true. So when is spine surgery potentially a good option?